So here you can see normal lung. Whenever we put our convex type of probe in the chest, anywhere in the chest, mostly when we put in the second intercostal space, we can see this type of lines. This is pleura, this is rib shadow, and besides this, the lung is continuously moved just below the pleura. So we can see the lung sliding. We can see the A lines. These are transverse line, 3 to 4, 5, 6, anything. Depending on the depth of the penetration, we can see different A lines. These are normal. This is pleura. And we can also see the lung sliding. When we are putting a M mode, we can see the lung sliding. Yes, there are two types of image, mostly anechoic image, hyperechoic image. So here you can see this is the anechoic image. So it is hyperechoic image. So here you can see the rib shadow. So this is the normal lung. This is the normal lung, and the lungs is continuously moving. The pleura is normal. The ribs are normal. The lung sliding is normal, and there is proper aeration in the lungs. So this is normal lung only. So what is A line? A lines are horizontal. Hyperechoic lines, yes, hyperechoic. Those who are looking have brighter images, they are known as hyperechoic. These black images are anechoic. That appears beneath the pleural line. They are just below the pleural line, representing a normal aerated lungs. So whenever you are getting A lines, there is no lung pathology. It represents a normal aerated lungs, and it is just below the pleura. They are horizontal, and there are 3 to 4 A lines we can get in a single lung ultrasound image. A lines are horizontal, hyperechoic lines. These are equidistant from each other and fade with the depth. So see, the distance between the two lines are always equal, and they generally fade with the depth. Whenever the depth increases, they fade. Along with the normal lung sliding indicates a healthy and aerated lung. So what A line represents? What is the significance of A line? Now A lines is normal lines. They are found in the normal lungs. It indicates that lungs is very much healthy. The lungs is properly aerated with so much of air, and we can see a proper lung sliding. So this is the significance of A line. So whenever we come across A line, we found that we assume that the lung is normal. Coming to B lines. So here you can see whenever we are putting a probe, we can see A lines are transverse line, equidistant line, and generally fade with the depth. But here you can see different vertical waves. We can see the vertical waves. Less than 3 is normal. More than equal to 3 is always abnormal. So what is signifies pulmonary edema? So whenever getting B lines on the ultrasound, it is always abnormal, and it signifies pulmonary edema. Here you can see this is the ribs. This is the rib shadow. This is mostly the pleura. And this from pleura, we see different vertical lines. The ultrasound machine are along the depth of the lung. There are more. If you find less than 3 or nearly equal to 3, then it is nearly normal. If you find a image having more than 3 to 5 types of B lines, then it is always abnormal, and we will definitely check for pulmonary edema. So let us have a literature on B lines. Vertical, yes, hyperechoic lines that originate from the pleura line. So they are hyperechoic. They are hyperechoic, vertical. They originate from the pleura and extend to the bottom of the ultrasound screen without fading. So here there is no fading. In the A lines, we get some amount of fading. This is a sign of increase in the fluid or density of the lungs, often indicating the condition like pulmonary edema or interstitial lungs disease. So mostly we come across pulmonary edema only. CKD patients come toward the casualty in severe respiratory distress, frothing from the mouth. We generally just put a ultrasound machine or just probe in the chest. You will definitely get so much of B lines. You clearly diagnose this case as a pulmonary edema, and you treat the patient. No need to do the chest X-ray. No need to. It will take time. It is very easy, very quick, very sensitive, and you can easily detect pulmonary edema. There is no fading also in the B line, so it is very easy to pick up pulmonary edema by the help of lung ultrasound. Fine. This is all our OSCE questions. These are not OSCE questions. So see how tricky OSCE questions can be.